now invite on stage Captain Albe Zakaria. He is General Manager MOL Maritime India Private Limited to present the proceedings for the entire conference.
Hi, good evening, esteemed guest. My pages, I've got around 5-6 pages, I don't know. I was just writing and writing, I couldn't even look up and see the deliberations. Anyway, what I've written down is not my thoughts, what was spoken here. So please do not come back to me and ask me, sir, why did you write this? So I will just start with it. Yeah, I start with Captain Azad. He mentioned about open to suggestions, incorporate international guidelines. The main idea is to save lives, and he also indicated the age of the doctors and how to go about it. And then we had the DG Shipping sir who came in, and he presented about domain specialist, then about psychoanalysis, lab, NABL, NABH and ISO standards, scope of medical testing, lifestyle issues, wellness, and Sagar Mein Yog, wellness at sea. He made a brief statement about it. Then Captain Nitin Mukesh spoke about the merchant shipping medical examination rules 2025, explaining in detail which replaces the 2000 rules, and it is more of an evidence-based test assessment which includes regulation updates, enhance medical standards, provide various standards for transgender employment, record keeping, stronger compliance and approval process, eligibility for doctors registration, MBBS, Ayush doctors. Then the clinic, accreditation, NABL, NABH, ISO 1589-2022 formal tie-up with accredited lab. Then mandatory approval certificate, AERB, fire, NOC, pollution, CA approval, biomedical waste approval, training and knowledge. Then the DG approval course, trained by DGS approved clinics for certification of DG certified doctors. And then there was a presentation from CMS where it was explained about the online platform which is being created for ease of registering various issues and the certificate which needs to be issued to seafarers. In the panel discussion, from the industry side, the challenges faced on Indian seafarers who go on foreign flag vessels, non-disclosure by the seafarer, the lifestyle diseases and the quality of doctors who do their medical test. Then there was mention about discrepancy in medical fitness when a seafarer is given fit and the medication what he needs to carry, whether he is carrying the actual medication on board or just not carrying any medication. Go extra mile for the medical fitness, cost to pay, employer needs to decide. Medical examiner, how to control cost. Quality companies does not dispute rates, they support. Would government support feedback from the PNI club for training of doctors and impart in the PME? From the doctor side, course was made for 2 weeks, the revalidation course. Then it became 10 days, then 5 days, then 1 day, half day course. This needs a review. Then additional training for doctors for occupational health and wellness. And then there was a mention that only fully fit seafarers to be sent on board. And for the panel discussion number 2, from the ship owner side, medical sign-off, the gaps and the fitness, DG guidelines to address, quality of examination, quality of clinics to improve. And there was a mention by one of the companies that 32% PME is unfit, so that needs to be checked. Basis on the age, the test to change along with the cost. Seafarer to be made conscious about their own fitness. From the doctor's side, it was NABH, NABL, ISO accreditations and how to apply it. And there was a mention that even if you have this standard, there is no guarantee on the reduction in the unfit report. We also required to look at the evaluation of a disease when a seafarer is completing his PME, which may not be visible at that time. NABL accreditation, the arm twisting tactics of the NABL, and whether we can look at alternate certification. Advantages of NABL, which was explained from the DG side, and why the NABL is needed, because that is a standard which is a government standard and the DG is looking at this standard. Complying with NABL and ISO, what is the guarantee that unfit ones still escape? What to do? Rather going for NABL, look at some alternate certification by private agencies like CMC Vellore for lab testing. From the administration side, NABL creates quality of test. It is a government body which creates uniform standards. Difference between accreditation and certification, due to which accreditation is more important than certification. Standards have to be acceptable to all, and the DG has put it on table that it has to be discussed among the doctors and they come up with a proper solution. Then there was mentioned that in a clinic only 2 doctors will be allowed, and this is difficult to handle in a metro city where you have many seafarers coming for testing. So this needs to be looked into by the administration side. And it was clarified by the administration that seafarers above 65 not to send on board. If seafarers are being sent above 65 years, a message has to be sent to MMD, and this has to be verified from the MMD side with the lab test reports to be attached. 70 years is the cutoff for foreign flag vessels. If doctor send the report and there is no reply from the DG side, it is to be assumed that the person is fit and there is no problem. Panel discussion number 3, from the doctor side, suitability about Ayush doctors. The Ayush doctor explained in detail the certification process and the tests, what they do, and the additional requirements which they follow prior they get their certification. From the ship owner's side, medical guidelines, certification of seafarers to clarify in case of borderline cases whether it is to be fit or made unfit. Suitability of Ayush doctors, ship owners have said that needs further discussion. Then cost of various diseases, PNI claims, which goes up, that has to be included in the repatriation cost. This needs to be checked. From the doctor's side, unfit cases to be checked as per Appendix E of the ILO guidelines. Similar goes for the blood pressure guidelines, and in India hearing aid is not allowed, and in other countries hearing aid is allowed. We need to check this as per international guidelines. Similar case with eye standard, whether we need to wear glasses or the pros and cons of a LASIK surgery. From the administration side, the Ayush doctor suitability was explained, where they need to submit a syllabus, their curriculum to the directive, and to check and evaluate and approve, and to be made at par with MBBS doctors. From the ship manager's side, no standard for mental fitness. PF16 is not a reliable test. Some companies do CDS test, MCMI test, which are very good and observed no failures. Kidney stones, the question is whether it is PME fail, if the stone is small. There was a debate on it, and it was agreed that for kidney stones, the kidney has to be free of stones. Then there was debate on the BMI, muscle mass, core density to include or not to include. There was no conclusion. Similar case, there was the discussion on heart stent fit or unfit. From the doctor's side, it was mentioned about psychometric evaluation. No psychometric evaluation is accurate. So it is still a question mark there. Then seafarers required to be stone free. Cardiovascular condition, angioplasty to be allowed, subject it meets the standard. Bypass condition to be allowed after some period, 6 months subject to satisfactory cardiac evaluation test. PNI has no objection to such condition provided the local doctor who is certified by DG allows such cases. If cardiac injury and stent is placed, a cardiac evaluation needs to be completed. Validity of medical certificate is 2 years and for less than 18 years is 1 year. It is up to the doctor to give a medical fitness for maximum of 2 years or less than 2 years basis on the doctor's evaluation and to consider the fitness accordingly. Thank you very much.
Thank you, Captain Zakaria, for those detailed proceedings. Thank you very much. I know it's a very tough job. I would invite Captain Mohan Naik to please come ahead and help us felicitate Captain Zakaria. Thank you, gentlemen. As we come to the closing of this particular conclave, I would want to invite on stage Dr. Jacob Matthew for his final remarks.
I must thank all of you all for coming for this conclave, but I won't waste much time. We're going to, I think the tea is there ready, and so I think that's more important. I just want to thank all of you all for coming for this conclave, and especially for DG Shipping, Directorate of Shipping, for organizing this conclave. But I want to tell two things to all of you all. This would not have been possible without the help of the FOSMA, MASA, and the other stakeholders. They are not medical examiners, but they have struck out and come wholeheartedly to help all of us. And my second plea to all of you all is that we doctors have to get together and have an association and represent our views to the administration. How it goes, time will tell, but we have to bury our differences and come together just like the stakeholders if we have to really progress. Thank you.
So I request my colleague, Ms. Delphine Estevero, to propose a final vote of thanks.
Hello, I won't take much of your time. Good evening, everyone. Distinguished guests, respected speakers, and esteemed participants. As we come to the close of the Marine Medical Examiners Conclave 2025, it is my privilege to extend our heartfelt gratitude to all those who have contributed to making this event a resounding success. First and foremost, I would like to thank our chief guest, Mr. Shyam Jagannathan, our guest of honor, Captain S.I. Abul Kalam Azad, esteemed speakers and panelists, for their valuable insight and thought-provoking discussions. Your expertise and passion for advancing the field of medical examinations have been a source of inspiration for all of us. We are truly grateful for the time and effort you dedicated to sharing your knowledge with us. We also extend our deepest appreciation to all the delegates and participants who joined us both in person and virtually. Your active engagement and keen interest in the sessions have enriched our discussions, and we are confident that each of you is leaving with new perspectives and ideas to enhance your practice. A special thanks to our organizing committee, who meticulous planning and hard work behind the scenes ensured the smooth execution of the conclave. From logistics to coordination, your efforts have been truly outstanding. We are also grateful to our contributors and partners for their continued support and commitment to this event. Your generosity has played a pivotal role in making this conclave possible. Finally, we would like to thank all the attendees and their enthusiasm, collaboration, and support. It is because of each of you that the Marine Medical Examiners Conclave 2025 has become a memorable and successful event. We look forward to continuing our work together and to seeing you again in the future editions of this conclave. Thank you and have a wonderful evening.